The Ministry of Health Permanent Secretary, Dr. Diana Atwine, has pledged to lobby Parliament for increased funding to scale up efforts to prevent and manage sickle cell disease. Dr. Atwine made the remarks during the launch of a nationwide mandatory newborn screening program for sickle cell disease at the Ministry of Health headquarters near Wandegeya in Kampala.
Under 5 mortality. These are global indicators that we also subscribe to, and we must ensure that we reduce under 5 mortality. But as you heard, about out of 20,000 children that are born with sickle cell, between 6 and 9,000 babies die before they get to 5 years. And so if we are targeting reducing under 5, we must target sickle cell disease. You have had previously, you've had challenges, getting blood, for cancers. Patients with leukemia take a lot of blood. Our mothers that are delivering take a lot of blood. Our children with malaria take a lot of blood. But children with sickle cell disease are blood guzzlers.
She was accompanied by the Director General of Health Services, Dr. Charles Olaro, chairperson of the National Task Force on Sickle Cell Disease, Prof Sarah Kiguli. She assured the public that screening kits would remain available in both government and private health facilities across the country, and said the ministry will strengthen partnerships to increase public awareness on prevention, early identification, treatment, and long-term care.
Government has done quite a lot, and I know that people are asking, but why now? What then? Why now? So what? When we screen, so what? We are going to provide you those answers today. First of all, we integrated the sickle cell disease prevention, diagnosis, and care into our public health system. We no longer want to have verticalized, so that everywhere you go in the hospitals, we see that the children are screened at birth, but also the children that have sickle cell disease are followed up. We have also established dedicated sickle cell clinics where we have specialists to deal with those difficult. You've heard that we get these sickle cell children come with many complications.
Dr. Atwine also urged the couples to undergo screening before having children, warning that failure to test exposes families to lifelong health and financial challenges associated with sickle cell disease.
We link these children to care, to early care, so that we prevent complications. By these children getting early vaccination, we give them penicillin as prophylaxis. We give them disease-modifying therapy like hydroxyurea. We counsel the mothers so that they look out for any possible complication or anything that require urgent attention. And because of that, it reduces morbidity but also mortality.
Dr. Olaro called on development partners to intensify their support, drawing parallels with the multi-sectoral approach used to combat HIV/AIDS.
Together with the Archbishop, but we invited them with short notice. But we still will engagement with the religious leaders and cultural leaders so that we can be able to push this agenda. We want to see that the same efforts which we put in to fight HIV, which also we will be able to put in to fight what? Address the aspect of sickle cell. So we encourage that as we engage, let's openly ask questions, so that if you have any unanswered one, we can help you carry this message beyond this area.
He praised the media for advocacy, religious leaders for mobilizing communities, and cultural leaders for helping reduce stigma against people